Once the clinician feels comfortable using the Supernova for intraoperative nasal CPAP, we now want to introduce nasal ventilation. Just like nasal CPAP, we need to generate a positive pressure. So to do so, we have to make sure that oxygen is flowing from the anesthesia machine to the Supernova. Again, we want to look at the anesthesia machine and make sure oxygen is turned on and that the flow meters are above 5 liters per minute. When this occurs, this allows for a continuous flow of oxygen into the Supernova and eventually into the patient, which will allow us to generate pressure. Next, we want to make sure that the Supernova is again connected to an anesthesia circuit. We then place the Supernova loosely on the patient while they're awake. Once the patient falls asleep, we tighten the Velcro straps and make sure that a seal is created around the patient's nose. In order to generate pressure, tell the clinician to set the pop-off valve between 20 and 30 centimeters of water pressure. Notice this is different than nasal CPAP. For nasal ventilation, we need to generate higher pressures in order to effectively ventilate the patient. As shown here on the pop-off valve is set at 30 centimeters of water pressure. This will allow for a continuous positive pressure of 30 centimeters of water. Next, we have to make sure that there is no leaks in the system. In order to do so, look at the anesthesia bag. Make sure that the anesthesia bag is completely inflated. This will ensure that there are no leaks. If the anesthesia bag does not inflate, the first place to check for a leak will be around the Supernova. Next, let's go over the steps for nasal ventilation. Again, make sure that oxygen is turned on. Right now, oxygen is flowing at 12 liters per minute. This way we know that a continuous supply of oxygen is being delivered to the patient and pressure can be generated. Next, have the clinician turn the pop-off valve to either 20 or 30 centimeters of water pressure. This will ensure enough pressure is delivered to the patient to effectively ventilate the patient. After that, again, ensure that the anesthesia bag inflates and stays inflated. This ensures that there are no leaks in the system. Next, ask the clinician to squeeze the bag. It should reinflate like so. We need to get the clinician to believe in nasal ventilation and its clinical benefits. Therefore, it's our job to remind them while they're performing nasal ventilation what the clinical benefits are. Explain to them that nasal ventilation has been shown to have lower peak airway pressures than full face mask ventilation. The clinical benefit behind this is it potentially could lead to less barrel trauma. Next, point out how the Supernova is easier to hold and makes mask ventilation easier than traditional full face mask ventilation. Also, explain how it should be easier to create a seal on patients that should be known difficult ventilations, such as the morbidly obese, patients with beards, and patients that are edentulous. It's important to explain that it's easier to create a seal around the Supernova because you're only pushing on solid structures. Also, explain that patients seem to feel it's more comfortable and that they're less claustrophobic because it's only covering their nose, not their nose and mouth. Finally, point out that patients can still communicate with them. Next, we have to explain that what parameters we want to look for in order to evaluate whether or not the Supernova is truly being effective. Finally, it's important to explain to the clinician that there are key parameters that will help them evaluate the effectiveness of the Supernova technology. Finally, it's important to explain to the clinician that there will be key parameters which will help them evaluate the effectiveness of the Supernova device. Next, you need to explain to the clinician how to hold the mask for nasal ventilation. Let's first start with our thumb technique. If you look here in the photo, you tell the clinician to use their thumb and push down hard into the mask. This creates a seal around the patient's nose. Next, have the clinician use their middle finger and apply pressure in the submental space. That's the soft tissue just below the jaw. Also, have them lift the jaw up, just like they normally would for full face mask ventilation. So in summary, the thumb technique is as follows. The thumb pushes down into the mask. The middle finger applies a small amount of pressure just below the jaw on the soft tissue known as the submental space, and they lift the jaw up. Next, let's discuss the key parameters that you want to advise the clinician to monitor in order for them to ensure that they are effectively ventilating the patient. The first is they want to monitor for chest rise. Every time they deliver a breath, they should see the patient's chest rising. Next, they should monitor for condensation in the mask. Finally, the anesthesia bag. They should feel that after they give a breath, the anesthesia bag quickly reinflates. All three of these monitors will help them determine whether or not they are effectively ventilating the patient. It's important to make sure that the clinician feels comfortable performing nasal ventilation on their own. In order to do so, we need to create a bridge where the clinician performs nasal ventilation and sets a supernova up for nasal ventilation in front of you. While they're performing nasal ventilation, it's also very important to reiterate to the clinician what positive effects to look for. They should be able to tell you that it is easier to hold, that they found that it was easier to create a seal around patients that are normally difficult to ventilate patients. Also, they should be able to recognize that patients feel as though it's more comfortable, that they feel less claustrophobic, and that they're still able to communicate. It is important to repeat this process until the clinician is ready to perform nasal ventilation on their own. Let's summarize how to set the supernova up for nasal ventilation and how to monitor to make sure the patient is effectively being ventilated. First, turn the oxygen on. Second, place the supernova loosely over the patient's face while the patient is still awake. Once the patient goes off to sleep, tighten the Velcro straps to create a seal around the patient's nose. Have the clinician set the pop-off valve between 20 and 30 centimeters of water pressure. Next, have the clinician perform the thumb technique in order to mask ventilate the patient. Then, make sure the anesthesia bag completely inflates, and every time the physician squeezes the bag, they should see the following: chest rise, mask condensation, and the anesthesia bag quickly reinflating.